And also we come out because we're moving on to this really important story as well. A shooting incident at the new Somerset Hospital resulted in the death of 2 patients and 1 police officer. The Deputy Health Minister Sibongiseni Dhlomo visited the hospital earlier on today. He joins me now for an update on that situation. Deputy Minister, I've got to thank you for your time and your patience as we were going through the issues of your organization on the other side. But on a serious note, Deputy Minister, you visited the new Somerset Hospital earlier on today after that shooting incident. Now, it's a bit of a confusing situation and a concerning one as well, given the vulnerability that it seems to be exposing around facilities such as hospitals. Talk to me about what you found when you visited the hospital. What do you know about this incident at this point?
No, thank you very much, and thanks to your viewers. As soon as I heard about this incident, I spoke to my minister, Dr. Kapasha, and said maybe it would be a good gesture that I'm here in Cape Town to really go and visit the new Somerset Hospital. Of course, having spoken to the MEC, Dr. Mbombo, also during the morning session. My immediate response when I went into the hospital was to, can you really show me this brave matron who was standing between the shooter and the gun? And of course, they indicated that she's doing a night duty, so she was not there at the time I visited. I was very delighted to find that all our staff members, largely nurses and largely were females, who we should have visited anytime, anyway, to say Happy Mother's Day today, were already, and we couldn't, but we're in a session of getting some counseling. And it was those staff members who witnessed this tragic incident yesterday. So I want to comment quickly the decision that has been taken by the hospital together with the MEC to get our staff members quickly in through this counseling session, because what they actually found there was, what we actually went through yesterday was really something we would not want to see or happening even to our enemy. So yes, the bodies have been collected. When I came in there, one of the family members who has actually been identified had just left the hospital, family members of one of the deceased. One other patient who also is deceased has not really been identified with the family where he comes from, and that is still a process that is being worked out. But look, in that situation, I want to say to you, sir, we have done everything humanly possible in our country in terms of the safety and security of our patients. Even if I am a worker in the new Somerset Hospital, if I do come with a gun, it will actually have to be left at the gate so that I go into a very safe environment, not only just for me, for my patients and from other staff members. Only for police and those who are in the duty, like a police, would walk into the hospital with a gun. Of course, this one was actually on duty guarding another patient, and he listened to a commotion and therefore wanted to attend. One of the person, the shooter, grabbed the gun from the police. So it's not like there was any negligence by the hospital, by the staff. The gun was not within the hospital from one of our staff members.
All right, that's an important point of clarity then, Deputy Minister, that this was not a gun that was already within the hospital environment. You can confirm that it came in under those exceptions that you make, because hospitals are gun-free zones, except for police officers and other officials. I imagine correctional services, for example, when they bring in inmates for health checkups, etc. Those are exceptions to the norm. Hospitals are gun-free zones.
And unfortunately, this policeman, may his soul rest in peace, would probably not have been suspecting that somebody would come in so close to him, because the policeman was not carrying a gun in his hand. He actually puts it in the right place where police usually put the guns, that somebody would probably come in so close to him to grab a gun and immediately use it against the police as a start. And when the police was now defenseless down there, then he used it to other 2 patients. That's why I say I commend that heroine nurse who came in at that spot and stood between that gun and this shooter to say, please, can I assist you? What can we do for you? Because I can imagine if that heroin matron probably did not venture into that space, many more other patients would have died. We don't know yet what was in the mind of this patient who had already been discharged, about to go home anyway.
Yeah. So as far as you can assess then, Deputy Minister, for the broader system beyond this incident, this doesn't call for a review of your policies around the handling of firearms and the duty of care if someone is handling or is in possession of a firearm within the hospital environment. I'm asking this because I've heard anecdotally a few people talking about their concerns, for instance, when inmates are brought in at some of your facilities, Charlotte Maxeke Academic Hospital, when it's operating at its full capacity, as well as other facilities, that there's always this niggling concern that what if someone were to grab this firearm in such an environment. But are you saying to me that from this incident you are pretty satisfied that your policies around this issue are intact and adequate?
In fact, it confirms that we were correct when we had incidences of doctors being killed in some of the hospitals. You probably in the past years in Mpumalanga, Rob Ferreira, a doctor actually killed by a patient there, and in some of the other hospitals in Free State. So we were correct as health not to make it as a gun-free space. However, we probably need to look into this to say what happens to our policemen and women who necessarily have to come into hospital with some of those inmates who are to come in and seek health care. How should probably they handle themselves? Could they add on and be checking? But they can't also leave. They can't leave the guns at the gate. They are with the inmates who have to be guarded right through. So it probably may call for some vigilance, and I'm sure this will also come around that space because they are definitely, it was unsuspecting that this will happen. So I think it's very difficult to say what should happen, but we will actually have to protect and make sure that our policemen and women will come into that point of duty with the guns, but we just have to make sure they don't really allow me and anybody else to come close to their personal space to really be able to take the gun and use it the way this shooter used it.
All right, Deputy Minister, I've got to thank you for your time and your patience as well, as I said earlier on. I'm wondering if I can be unfair to you and throw in a completely unrelated question, and if you are not able to speak to it directly, I will fully understand. Just on the response to the COVID-19 situation, what is your department's reading of where we are in terms of the trajectory towards a fifth wave? And related to that, in response to you gazetting these regulations, just clarify there what the position is, because our understanding was that there was an extension of the period for public comment around the regulations to respond to epidemics and pandemics in future, including but not necessarily specific to COVID-19, but within that you adopted some that are interim in nature. While the response seems to have been, we'll see you in court, there are a few organizations that are saying that what you've done makes absolutely no sense. It's irrational to adopt these while you still have a consultation process underway. Just your thinking around the fifth wave as well as the standing of the regulations that you have now in place.
Well, I'll end with the fifth wave scenario. Let me start by saying the minister, advised by some of the people who are helping us, scientists, we have extended this period of consultations and comments on regulations up to the 5th of July. But there were 3 specific regulations. Because you are right, those ones are quite broad. They were to do with any medical condition at any given time. But there's 3 that we really wanted to champion earlier and ahead of the rest, are dealing with 1, the wearing of mask, which actually, by the way, there was a bit of a challenge and a mistake. We still insist of wearing of the mask in the classroom, at high school, at the primary school, anywhere, as we would also insist on the wearing of the mask in any closed confinement, wearing no mask when you are outdoor. That part was actually the one that we really want to insist on, at least as going forward. Number two, it was the issue of gatherings that we would want to actually make sure that gatherings are at this level, at that number, 1,000 rand indoors and 2,000 outdoors if you don't wish to wear a mask. But if you want to have a 50% of the venue, the 6,000 auditorium in church, then half of that must be when people are wearing masks. And then the third one was with regards to the travelers, as to what regulations we have. So those are the three that we say while we are busy getting more comments, but we would like to have these ones going forward, guiding us, because you'd know, sir, there will be a lacuna and the space and the gap when we don't deal with those in spite of COVID-19 still going up, as we are saying on the figures. Yes, we are sitting at quite a significant number. Today, I was listening, we are sitting at about 31% positivity rate, which is way above what WHO is recommending as 5%. Anything above that, it means you are really in a pandemic, is not a controllable issue. Number two, we are also getting new admissions into hospitals, not so much in the ICU. What scientists are still putting together is to should you or should you not call this a fifth wave in the event that they are actually ascribing a new wave to a new variant. Right now, we are not dealing with a new variant. It's still Omicron. It's just a BA, is a BA 0.4 and 0.5, while we were dealing initially at the wave 4 with the BA 1 and 2. So they are actually saying, by definition, if there's not been a new variant in that space, you probably, even with the increasing numbers, would not call that a fifth wave, probably because we are coming in from the Easter weekends and a lot of us were moving around in the country. Look, but now, whether you are here or not, in terms of the wave being there, we are now noticing that there are increasing numbers of our people getting COVID-19 infections. There are admissions getting into hospitals. Yes, not significantly so in the ICU. The positivity rate is sitting above 30%. So those are some of the features that would define a fifth wave. Watch and see what happens, and we'll give you an update as we go along. Thank you very much.
Dr. Sibongiseni Dhlomo, I've got to thank you for your time and your accommodation there of that extra question that I threw in there. He is, of course, the Deputy Minister of Health, just giving us an update on that situation at New Somerset Hospital that he visited a bit earlier on following that shooting incident that happened yesterday. But also you will take from what he said there at the end about the situation with COVID-19. Technically, not in the fifth wave, because the scientists are saying we're not dealing with a new variant, but sub-variants of Omicron. But, you know, use your mind and just make up your mind where things stand and what precautions you need to be taking, given the numbers that are going up, including hospitalizations, as the Deputy Minister has said there.